Welcome. Welcome. Thank you for visiting Hudson Valley ADL Center. My name is Jennifer. This video is an introduction to industrial rehabilitation. Industrial rehabilitation is improving the capacity of a worker to perform a job. To receive industrial rehabilitation implies a worker was injured. Our practice includes evaluations post-employment, during work and after injury. Research to link musculoskeletal disorder to work injuries has been conducted in industrial settings. These days work injuries are seen in office and hospital settings as well. Hudson Valley ADL Center is providing this service to the community, and this presentation describes work rehabilitation process. How our therapists create a healthy workforce. Today's agenda is as here. We evaluate an individual's ability to demands of the job. Lift, move, posture, repetitive motion, strength, experience, age and psychology play an important role in the matchup. Generally given a worker's strength, ability is inversely related to demands of a job. Key components of a job are defined through a question-and-answer session with patient and possibly by visiting the job site. Several components constitute a job. Exertion is applied by the patient on a component and a measurement is recorded. The job is thus simulated and performance or physical ability measured. We create a healthy workforce by performing procedures to simulate your work conditions. A functional capacity evaluation is a series of tests used in predicting readiness to return to work following an injury and to assess a worker's functional capacities for specific work demands. A functional capacity evaluation can be performed at the time of hiring, change of work or loss of worker's capacity due to natural effects of aging. Work hardening is an individualized rehab program organized to improve function that interferes with vocational, physical, and psychological functioning. The program provides coordinated, outcome-oriented, interdisciplinary team services designed to minimize risk and optimize the work capability of the worker served. Work hardening programs utilize real or simulated work activities. Work conditioning is an individualized and structured rehabilitation program organized to improve function and quality of life with a goal of return to work. Work conditioning focuses on physical conditioning and functional activities related to work. Practical research has related disorders to work. Musculoskeletal disorders were defined for each research study. From a sampled population, and a percentage of prevalence is shown in the table for neck, shoulder, elbow, wrist and back. There is clear-cut evidence of 11 disorders with specific CPT codes. Patients with prescription from a physician can be treated at our facility and care can be compensated by insurance company. There is very high cost burden associated with worker injuries. Musculoskeletal disorders account for nearly 70 million physician office visits in the United States annually and an estimated 130 million total healthcare encounters including outpatient, hospital, and emergency room visits. In 1999, nearly 1 million people took time away from work to treat and recover from work-related musculoskeletal pain or impairment of function in the low back or upper extremities. Conservative estimates of the economic burden imposed, as measured by compensation costs, lost wages, and lost productivity, are between $45 to $54 billion annually. 3 factors, median wage and benefits, lost work days and disability payments determine costs. Median wage depends on your industry and your location. You may want to consider a figure of $50 per hour. To analyze it is multiplied by 8 hours in a day, by 220 days in a year for an estimate of lost wages. You can add to that direct disability payments, which may amount to 66% of median cost for life. There is little doubt that companies have an incentive to institute the program to manage these costs. A post-employment functional capacity program, when instituted, allows companies to properly assign new workers to tasks they can handle. An ongoing program can recognize worker injuries before they disable a worker. Offices and hospitals are increasingly instituting these programs. Insurers authorize treatment by recognizing the relationship between an injury and work setting. They play a key role in creating a healthy workforce. Physicians in direct one-on-one contact diagnose and order a functional capacity evaluation and possibly a rehabilitation program. And finally, in self-interest, an injured worker, via his attorney, can order a functional capacity evaluation and work hardening program. Each of our facility has state-of-the-art equipment, and our therapists are proficient in evaluation and treatment of musculoskeletal disorders. We have the recommended space for equipment and sufficient space for carrying out evaluation and extended treatment. A functional capacity evaluation takes about 4 hours. Substantial reporting is generated and sent to the physician and others. A work hardening or conditioning program takes 4 to 8 hours to simulate a workday. It is supervised by a therapist and other medical support staff. Our therapists are experienced in treating musculoskeletal disorders. With the use of equipment and a state license, they provide a valuable service to the community. As always, patient health care is paramount and is seamlessly managed. Office staff manages all communications from prescription, insurance authorizations and payments. We strive to help patient recover as soon as possible and return to activities of daily living.